Welcome to another edition of the South Florida Tribune podcast. My name is Scott Morganroth, Motor City Madmouth, and I am pleased to be joined by Gary Kornbluh tonight. And Gary, you know what? Today we had a lot of fun promoting medical insurance and health insurance. And just so you know, before you come on, the title of this show is Medicare Health Insurance Overview. And during the course of the broadcast, we're going to go over some of Gary's top shows. And he's had a lot of good ones, but you know, when you have an industry this comprehensive, you want to hit to a lot of the main ones, and I expect us to accomplish that tonight. So, Gary, welcome back to the South Florida Tribune podcast. Glad to have you.
Hey, Scott, thanks for having me back, and I'm excited to share with the viewers and listeners.
Very good. Well, you know, folks, get your pen and paper ready, and if that's not good enough, you can always go to the South Florida Tribune YouTube channel. You can watch it again. And you can also find it on www.southfloridatribune.com as well. But before I go any further, though, I do want to give everybody a programming note here on the network. The Fire Up series that we have that is currently running on Friday nights will be moving to Monday, June 6th. The Fire Up series, in case you haven't heard yet, is Fire Up Florida and Fire Up Michigan. Fire Up Florida, obviously, is a good program because we talk local sports, and we're going to be doing non-sports related type of shows. On that Fire Up Florida series, my co-hosts are Greg Fuchs and Mark Mancini. And on the Fire Up Florida series, the non-sports related, Greg Fuchs will be on there. We'll have a rotating co-host. On the Fire Up Michigan series, which I do shows from Michigan as well, my hometown, Metro Detroit, George Eichhorn and Mark Mancini are also my co-hosts as well. So I just want to get that programming note. And hopefully at some point we'll be able to bring Gary Kornbluh into the mix with the Fire Up Florida series way down the line when we get it going. So we'll give everybody a little bit of an overview as we get closer to it. Now, on to the business at hand. Okay, as I told you, folks, we're going to have an overview of 6 of Gary's programs. So we'll go over the ones. And if we have any other questions, that we'll continue to address them as we go along. All right, Gary. Well, so here... let's talk about the first broadcast that we're going to review. What do you want the audience to take from Cobra versus Marketplace or Medicare Insurance?
Well, the audience and listeners and everybody, what they should take from this subject, and it's really a decision that one is faced with when they leave their company, they're separated from service. There's an extension, a continuation of benefits. Under Cobra, it's 36 months. And so you're charged with really a very simple cost-benefit analysis. Does it make more sense to pay the full price for your health insurance? Because once you take Cobra, your company's subsidy goes away. So you're forced with paying full price. Or are you better off taking an alternative like a marketplace plan? So if you're under 65, then you would want to look at a comparable marketplace plan. My experience has been that usually one is better off taking individual insurance through the marketplace, whether it's with or without a subsidy. They're usually better off taking marketplace coverage. But again, it's a cost-benefit analysis. So, it's very simple. What am I paying with my Cobra program? What am I getting? What am I going to be paying through the marketplace, which could include a tax credit. So that could reduce your cost. And then what am I getting? Am I getting a comparable plan? In most cases, you can get a comparable plan. And if you meet the criteria, you could get a tax credit and really reduce your costs pretty substantially, less than the full priced Cobra plan. Now the same can be said for people that are on Medicare. So if you're Medicare eligible, you could be under 65 if you're disabled, but usually at 65 one ages into Medicare, and then you could be faced with the same decision. Many people now, especially nowadays, are working beyond 65. So really, it's very easy that when you turn 65, the government will issue you a Medicare card with Part A. even if you're working and you've got group coverage, because that's the free part of Medicare. However, you'll want to make absolutely certain that you're not enrolled in Part B. You can actually delay your Part B until the day that you decide to either retire and lose your group benefits that way, or you just decide to leave your group plan and take Medicare. So it's really a very similar analysis, whether you're under 65 and you're going from Cobra to Marketplace coverage, or short-term medical coverage, which is one of my shows, so we'll discuss that in more detail. Or you're Medicare eligible and you're faced with that Cobra question. But again, whether you're under 65 or you're 65 and older and you're Medicare, usually I would say 80 to 85% of the time, you're actually better off taking the Marketplace coverage or the Medicare coverage and not staying on the Cobra plan. Now, there are situations where many retirees have full group retirement benefits, even past 65, and that are fully paid. I mean, if you're an executive or if you held a pretty good position, or a lot of the government plans from the different states offer fully paid retirement benefits, then you'll want to keep that type of plan. You'll usually never want to cancel that plan, because once you cancel those plans, you can never get them back. So be careful if you're in that situation. Now, of course, if you're eligible for some of the government plans, like VA coverage, TRICARE, CHAMP VA, etc., there are certain policies, especially once you're eligible for Medicare, there are certain plans that can be more beneficial than others. If you're, if you served in active duty, or even if you're just getting, VA benefits, and it doesn't even have to be full VA medical benefits. You could just be getting VA drug coverage, and there's still a good, a more suitable Medicare Advantage plan out there for you. Some call it the Patriot plan, some call it the Honor plans, but it's designed for the VA recipient, and it actually gives them a credit toward their Social Security. So these are some. I don't want to get too far into the weeds. I mean, you can always call me. I'll leave my contact information at the end. But again, just to summarize, what I want the viewers and listeners to do is just, if you can do it yourself, but it's just a cost-benefit analysis. You're always better off using an agent. That's what we're trained for, and I'd be more than happy to help. But that's essentially what you need to do. What am I getting? What am I paying? Versus what am I getting? What am I paying? I know I'm oversimplifying it that way, but again, that's where a good, competent agent comes in, because they can usually help you determine the best course of action.
Well, so the bottom line is, whether it's Cobra, Marketplace, or Medicare, it would be to everybody's benefit. Just find an agent out there, and they'll be able to break down each and every one of these things and then guide you accordingly. Is that correct?
Absolutely, because the problem is, if you make a bad decision, it could be detrimental, to your financial situation. So you really want to make sure that you make the right decision from the start. To use somebody, that's been in the business a long time. I've been in the business over 30 years, so that probably qualifies for a long time. But just use somebody that's competent. Maybe search their Google reviews and see what kind of reviews they get. I know thank God I enjoy many Google 5-star reviews. But again, Google these people and, check them out. See what other people are saying about them. That's a great way to at least give you the incentive to reach out to an agent or an agency if they've got a good rating.
Very good. Okay. Well, obviously, as we continue to go through these broadcasts, okay, how do you not talk about how COVID-19 has affected the health insurance and medical industry? Because we know that COVID-19 has run havoc throughout the last couple of years. regardless of the industry. But you've probably had to deal with a lot of these challenges, particularly since you have a 215 license as well. That is your area of expertise. So, just give a basic overview about obviously COVID-19 and what it's done to this industry.
Well, the timing is interesting because we just hit our 1,000,000-mile mark of deaths from COVID. So it's timely to talk about it. I'll be brief, but COVID has affected the entire global economy, not just us here in the States. It's changed the way we do business. It's really wreaked havoc on the supply chain and with so many businesses. Again, whether you're buying furniture or an automobile, or it just doesn't seem to matter. The supply chain is just in just really bad shape. It seems to be improving a little bit, but not much. But COVID has affected. I think long term, it's going to create. I hate to say this, but I think it will probably create higher premiums in the long term because of the much higher cost associated with, treating these people. And that would include conditions that persist way beyond your getting over the initial COVID infection. And it's a condition now. We've talked about it before, Scott. It's called long COVID. And the people that suffer are called long haulers. And they suffer from this long COVID. And with some people, it's absolutely debilitating. It just wreaks havoc on the body. Remember, COVID pretty much causes an inflammation reaction in the body, which means that any of your organs can be inflamed, including your brain. Your brain's an organ, right? So I've got clients that are suffering. I've got a common problem with some of my clients that are suffering from severe migraines, and there doesn't seem to be any remedy. Their doctors put them on these different medications. I know a new and effective treatment is Botox injections. That can be helpful. There are other injections you can get at the doctor level. But yeah, COVID has absolutely wreaked havoc on the world. I think it's now responsible for for the higher prices. It's affected the labor markets. It's caused lockdowns in many countries and affected their economies. And I just think it's a global issue. Right now, I know that North Korea seemed to dodge it for the first few years, but now they're on total lockdown. So the entire country of North Korea is now suffering with COVID. So it's upended the way we do business. It's changed. It's changed our world for forever in so many different ways. We're just now dealing with the aftermath.
Yeah, I think the one thing I just want to mention before we go on to Obamacare, Gary, is that people need to realize is that now COVID-19 will look as being a pre-existing condition. And I know a lot of insurance companies are going to try to nail you and increase your premiums, and let alone forget about the premiums. Let's just take that out of the equation. Now, obviously, the fact that you're going to have additional medical issues down the road and because of this condition cannot be undermined or understated as well. So you have higher premiums and after effects because of the virus itself. And I want to make sure that we bring that up to the forefront. So
that's true, Scott. That is true. But let me just, if I could comment on that.
Sure.
The good thing is that whether you're buying a Marketplace plan, okay, if you're under 65 or you're 65 and you're eligible for Medicare, there are plans that are guaranteed issue. So regardless of what condition you have, I mean, I've insured people that have cancer, God forbid, diabetes that take, more than 50 units of insulin daily. So again, the Marketplace plans are all guaranteed issue plans. So pre-existing conditions can come into play with certain policies. Life insurance, those are medically underwritten. Short-term medical, those are medically underwritten. And if you pass the guaranteed issue period on a Medicare supplement policy, they can be medically underwritten as well, which means you have to qualify medically. So what you're saying absolutely is can pertain to some policies, but most of the policies that people take are Marketplace and Medicare Advantage. And fortunately, I don't ask medical questions when it comes to those policies. Everybody, it's a take all comers situation.
Well, guarantee issue withstanding, the reality of the situation is folks are going to need additional Medicare because they were subjected to COVID-19. And just because you got rid of it doesn't mean you're not going to have to deal with health insurance or health issues down the road as a result of. And we'll leave it at that. Now we'll transition over to Obamacare. And obviously, many years ago, I benefited because of Obamacare. So anybody that were to criticize President Barack Obama, you'll get deaf ears out of me because that president saved my life. So I will not say anything derogatory about President Barack Obama. But that said, that's as far as politics I even go. Okay. Mm-hmm. So why don't we talk about the effect that your show had as we did address Obamacare? Because here's the thing. Previously, our other president, Donald Trump, wanted to get rid of it. And obviously, thankfully, that never took place. So, let's talk about Obamacare first and what you accomplished in that show.
Well, I think the viewers and listeners got a lot out of that show. There were a lot of moving parts to that show, such as open enrollment. And there are just so many moving parts to the Marketplace and Obamacare in general. But what you need, I guess the most important thing to take away from Obamacare is that these subsidies to help us pay for this insurance, let's face it, it's called the Affordable Care Act for a reason. It was designed to make health insurance more affordable, and it's worked. It's worked incredibly well. And you mentioned Obama, and of course, Biden was the vice president at the time. And I think they did a wonderful job. It's the law of the land and has been since they left office, since they enacted the law. And I think it's here to stay. I think that even if another Republican president, whomever that may be, gets into office, I think they're going to be very hard. I think it's going to be very difficult for them to replace Obamacare, a program that ensures millions and millions of Americans. It's been the law of the land for the past 8-9 years, and it's worked. And the American Rescue Plan just made it even that much more palatable because it increased the subsidies. The best thing to get out of Obamacare is, talk to an agent, see if you qualify for help paying for coverage. Maybe it's more cost effective than what you have through your group plan at work. There is a formula where an agent can determine if the plan that you're paying for at work is overpriced or it's not affordable. And in many cases, I've taken people and moved them to Marketplace coverage with subsidies, and these people were absolutely thrilled. So you really want to, each individual has their own individual circumstances. So that's why it's really important to just, call an agent, a competent agent that's licensed for health and Medicare. Don't call the auto and homeowners. Don't talk to your home and auto agent. Those guys are professionals at auto and homeowners insurance, not health insurance and Medicare. Speak specifically to a career health insurance and Medicare agent like myself. And by doing that, your agent will make certain that you qualify for the appropriate credit, that they assist you in the tax filing of these advanced premium tax credits and work with your CPA, and then make sure that you're getting the absolute best coverage for your premium dollar.
Very good. All right. Well, you know what? I know at some point or another, people are going to have to deal with it, whether it's now, later. But short-term medical insurance, boy, that's an open-ended one, isn't it? I know that at some point the audience are going to find that whether it's a family member, themselves, spouse, whatever the case is, this is no topic to take lightly at all, is it, Gary?
No, it's not, Scott, not at all, because this could bridge the gap between, let's say you lose coverage from an employer and you're on a probationary period and your new plan doesn't start for 3 months. What do you do? What's the solution? Short-term medical. You can take a plan out for as little as 3 months and cover that gap. And unfortunately, it seems to be when you don't have insurance is really when you need it the most. And as ironic as that sounds, I have found that to be so true. So these gap policies can be critical to fill that gap and get you that critical coverage between maybe group plans. You know, you're leaving one group, you're starting another group. Now, there's also just the other day, I helped a friend and we insured his 2 daughters with short-term medical. It was his 2 daughters. Yeah. So they needed just a very inexpensive medical plan. They're both very healthy. They both make too much money to receive tax credits. And that's really a prime example of where a short-term medical policy is the perfect fit. You don't qualify for a premium tax credit, right? Through the marketplace. So you're forced to pay full price through the marketplace, right? And yet you're healthy enough to qualify because these short-term medical plans are medically underwritten. Remember Scott mentioned pre-existing conditions? Well, this is one of those situations where you can't have any pre-existing conditions, or you simply won't get coverage. You'll be declined. So, short-term medical, in addition to covering those gaps in insurance that you may need, I have many clients that take that as their coverage all year long because they don't qualify for tax credits and yet they're healthy enough to qualify for the short-term medical. And if you saw the pricing, you would see that it's a fraction of the cost of a full-place marketplace plan. Let's say a full-place marketplace plan is $800 a month. Maybe short-term medical is $200 or $250. And it's very, very good coverage. It's actually a national, in most cases, they're national networks. So unlike most marketplace plans that are regional plans, you're only covered in your regional area, unless it's a medical emergency. You're covered wherever you are with any plan. But these short-term medical plans actually utilize national PPO networks. So I just insured a gentleman that travels all over the country and can be in any one state at any given time. This is a perfect solution for him. He's got an inexpensive, and he's healthy. He has an inexpensive policy, and God forbid, if the worst happens, his maximum out of pocket is limited to the deductible that he chose, and there's like 5 different deductibles. So short-term medical, Scott, can be a really critical part of your health insurance plan.
Very good. All right. So let's talk about dental, vision, and hearing benefits with Medicare Advantage. I mean, you can't lose sight of the fact that as we get older, the eyes need a little bit of work, the dental as well, and hearing. I mean, those are the 3 main components of how we get by, right? Got to have your hearing, got to have your vision. And of course, we talk about the dental. So in other words, folks, don't undermine or underestimate the importance of all 3, especially as you start to get into the Medicare area.
That's true, Scott. As we age, we tend to need more of those services, right?
Yeah.
Our teeth tend to get worse, our eyes tend to get worse, and our hearing tends to suffer as well. So these are really important. I call them ancillary benefits. On just keep in mind they're only available on the Medicare Advantage plans. If your choice is original Medicare and a supplement, you would have to buy those plans separately. But having said that, these plans are good, but don't get too excited about these plans in a Medicare Advantage policy. And the reason why is that the coverage is somewhat basic. I mean, the dental, most companies do offer both preventative and comprehensive dental, but they only give you like, I don't know, could be anywhere between $1,000 and $2,000 of coverage for the whole year. Now we know that doesn't go very far. And then, of course, if it's a Medicare Advantage HMO, you have further restrictions. You can only go to a general dentist because there are no specialists in an HMO, right? So if you take a PPO Medicare Advantage plan, you open up your window to not just general dentists, but specialists as well, endodontists, periodontists, etc. But again, don't get terribly excited because your dentist may or may not be in the network. So, which means that you'll have to use a participating provider, a provider that's in the network. The vision can be quite good in most cases. Most plans will give you an allowance. Usually, it's anywhere between $150 and $200, and you can use that toward your lenses, frames, or contacts, and that's a yearly benefit. So, of course, the eye doctor exam is free, and so the eye coverage, the eye benefit can be good. The hearing can also be quite good. My dad uses hearing aids, and this is a perfect benefit for somebody like him because it gives you, well, some plans have a copayment that you have to pay. So let's say it's $599 for a standard hearing aid, and let's say maybe it's $999 for a premium hearing aid. But these copayments usually represent about a 50% discount off the full retail price. But again, the dental, the vision, and the hearing, these are additional benefits that are offered on Medicare Advantage policies, as well as Medicare Part D, because then that's your drug coverage. So remember, your Medicare Advantage includes your drugs. That's your Medicare Part D. It includes your dental, some dental coverage, some vision coverage, and some hearing coverage. So a Medicare Advantage plan is typically referred to as a Part C, a Plan C, because it equals A, hospitalization, your B, your medical, and your D, your drugs. And then it adds in these other ancillary benefits. There are a lot of different Medicare Advantage plans to choose from. There are even give back plans that will credit your Social Security payment. Again, it comes down to talking to an agent that that is competent and is aware and understands your needs, your particular needs, and can recommend a solid solution.
Very good. All right. And the last point I want to get to at least tonight is Gary's the No Surprises Act. So that was a pretty interesting one. So why don't you give everybody an overview of the No Surprises Act? And before you do so, though, let everybody know out there that South Florida Tribune podcast, if you don't have access to the South Florida Tribune YouTube channel at the moment, can be accessed through Spotify, Apple, Google, as well as iHeartRadio as well. So if you can't see us on South Florida Tribune YouTube channel, you can certainly listen to the audio version. And let me go back, and if you can, well, once again, go ahead and please subscribe to the South Florida Tribune YouTube channel. You'll be able to get every show that we've done. We've done over 200 videos, so we know that there's a video for everybody, whether it's sports or non-sports related stuff. Gary's series is definitely amongst that South Florida Tribune YouTube videos that we have as well. So with that explained, and one other programming note, like I say, tomorrow night on WSFT Network, South Florida Tribune YouTube channel, as well as our audio partners, we'll have Fire Up Michigan tomorrow night with myself, Mark Mancini, and George Eichhorn. So we hope you can join us for that tonight. Meanwhile, tonight, South Florida Tribune podcast, I'm pleased to be joined by Gary Kornbluh. Gary's been with us for a long time, and we hope that we've had an opportunity to educate you. We'll get to a few of those closing thoughts shortly, but I do want to do a little bit of company previewing about what lies ahead. Another show we have to look forward to on Tuesday night, 108 Stitches Baseball Talk. Myself, Lou Landers, Rick Curdy, Eric Katz as well. So with that said, since we're not surprising anybody with those shows, we'll talk about the No Surprises Act. Like I said, what good segue, right, Gary?
Yeah, absolutely, Scott. And yeah, the No Surprises Act, it's really a consumer protection law that is long overdue. Scenario that everybody's familiar with. You're in the hospital for a surgery, and some doctor comes in and maybe he comes in and chats with you for a minute, and maybe he glances over at the EKG machine, and then all of a sudden you get billed from doctor so and so, and it used to be that you were not able to dispute those because Dr. So and so just happened to be in another network, not in your network. Can't the medical community cannot do that anymore. These healthcare facilities, doctors, be very, very cautious. Make sure you're recommending your colleagues that are in the patient's network, because if they get billed by a doctor or a service that was not legitimate, they now have a help desk that they can call and help them dispute these charges. So I think this, again, it's a consumer protection law. It's an important one, and it's really going to. I think the industry is going to benefit from this law. I think there's not going to be any more funny stuff going on about doctors or providers treating a patient that's and then expecting to be paid. Again, any doctor or specialist or hospital, they're going to make darn sure that these professionals are in your network, because they know that based on the new No Surprises Act, that now these consumers have recourse against them, and they can dispute these charges.
Well, the main thing I wanted to do when I brought up the No Surprises Act during the course of the broadcast is for every consumer out there nowadays, who do you trust? And that's why I brought this in the first place. And I wanted you to give a more detailed explanation, overview of what we accomplished that night, is the fact that, everybody's nervous. They don't know what they're getting, whether they're reading all the paperwork, whether it's explained to them properly and open-ended. And I think that was a strong aspect of doing the No Surprises Act, Gary, to make sure that everybody has to be conscious of what they're doing, or it'll get expensive, meaning costly. And you don't know what, and it could be expensive in a lot of ways, because you're probably going to get the wrong type of care if you don't understand what's going on. People go out there and say one thing, but if they don't know what they're talking about, then you got another Pandora's box opening up. And I don't want to bring attorneys involved or anything like that, but I know that agents can get sued as well. They have to, many of them, I don't know about the health insurance, but you have to make sure that you have some agents have to have insurance protect themselves. But we won't even talk about that tonight. The main point of the No Surprises Act is you've got to read everything that you're looking at, and you have to make sure that every T is crossed and every I is dotted, or it will get expensive. And you got to be conscious of who you trust. And like you say, do the research of the individuals, whether it's doctors or hospitals. And I do know, and I'm not getting into a credit report here, that one of the reasons why credit scores don't really be, when it comes to medical, to me, is the one thing when you look in the credit industry, they don't beat you up too bad when it comes to your credit because of the medical industry, because there's a lack of distrust in that area. So I'm not opening up a new Pandora's box. All I'm trying to do is emphasize that the No Surprises Act is there to protect everybody out there against the doctors and hospitals.
Yep, that's correct. That's correct. And So really, it's not so much the agents that could be liable. Really, I mean, the agent's responsibility is finding the best and most cost-effective plan for the consumer. It's really the doctors and the doctors' offices and the hospitals that really have to be cognizant of their patient's plan, what network they have, so that they don't send in specialists or doctors that are not in that patient's network, because ultimately they're not going to get paid if they send in a doctor that's not in the patient's network, because the patient will dispute that charge.
Very good.
Rightfully so.
Very, very good. So, all right, folks, if you want any in-depth information on any of these topics, go to our website, www.southfloridatribune.com, and look for Gary Kornbluh under the contributors' writings of the South Florida Tribune as well. So, Gary, I guess the main thing I really want to know is, what are you looking to accomplish down the road as you continue to educate people through this platform?
Well, Scott, you said it. You said the magic word, educate. So really, that's my goal long term, is as the more podcasts we do, the more I can educate the public. I think the better off we'll be. I think there's a lot of bad actors out there giving a lot of bad advice, and you really just need to make sure that you have a good, honest agent that's not out for their own pocket, which many agents are, unfortunately, but they truly have their client's best interest at heart. So it's really a matter of just, look, if you have to Google search the agent, by all means, Google search your agent. I don't care what vendor or who you use. Google is out there to give you an idea of what consumers are saying about this person or this professional or this business. So, by all means, search an agent, and, just be very careful when you're selecting a health insurance or Medicare agent, because, again, if you get a bad one and you make a bad decision, it could hurt you financially.
Well, I think excuse me, I think the one thing that you've been able to gain by what we're trying to accomplish here, or what we are accomplishing, is when people Google Gary Kornbluh out there, not only do they have an opportunity to see your writing, but they also have a chance to see your podcast as well. And as a result, I think that certainly helps bolster your ability, having been in the business for 32 years, I think 33 years. So when you have an individual who's been in the business for 30 plus years, and then you put together some outstanding articles and some broadcasts to complement it, then you certainly are way ahead of the game than most people out there. And I'm not patting our back or anything, but it's just another feather in your cap that you're able to proactively think about not only yourself, but the people that are out there that are looking at your shows. Because I think it's important that a lot of people know education, credibility. You're not some guy sitting behind a computer selling a plan. You're an individual who's getting out there in the forefront and letting people know who you are, what you look like, what you sound like, and put content or pen to paper and being able to talk. And I think that's where you hopefully have benefited greatly by what we've accomplished there as well. So any closing thoughts before we call it a night, Gary?
I had a thought, but it's escaped me. But I think we covered a lot of stuff, Scott. I guess the only other thing is, for those viewers or listeners that would like to call me and get some guidance, and I'd be just delighted to help you. I don't care if you're out of state. I mean, I'm licensed in Florida. I'm only licensed in Florida, but I help people in every state in the country. I get people that call me, and if I can give somebody guidance in North Carolina, I'm happy to do so. I'm not compensated, and I really don't care. My goal is to help people, and that's the way I've been successful. So call me. I'll give you my objective, totally unbiased opinion when you call. That I promise you. And again, my name is Gary. My website is www.medigapx.com. That's MEDIGAPX.com. and you can click on my testimonials tab and see what my wonderful clients have said about me. And then also you can reach me. My office number is 954-532-2060. The best way to get me is actually my cell. It's always on. I'm always available for my clients 24/7. And that number is area code 561-305-5949. I invite anybody to call me. No question is a bad one. Like our teacher used to tell us, the only bad question is the one that you didn't ask, right?
Well, mark my word, I've heard that line more times than you can imagine in my 42-year journalism career that's still going strong. So let me go over some information about us. If you haven't heard it before, go to our website, www.southfloridatribune.com. You can email us at southfloridatribune@gmail.com. You can find us on Twitter at Tribune South. And by all means, go ahead and subscribe to the South Florida Tribune YouTube channel, and you'll be able to get all the notifications of all the shows that we do, from the sports and non-sports related shows. I know that there's a show that everybody can benefit by, and we hope you have an opportunity to enjoy those as well. Our goal is to make sure we have very versatile programming, so everybody that comes to our website, our YouTube channel, gets the full benefit of that. I do want to give a shout out to Candy Ebling, who does an outstanding job on the website. More importantly, she does an amazing job getting these broadcasts up in a very timely manner as well. Without her, there's no way that we can get this done. So once again, www.southfloridatribune.com. And also, as I reiterated earlier, you go to iHeartRadio, Spotify, Google, and the rest of the audio sites, but mainly iHeartRadio, Spotify, Google as well. And you can find the shows as well, again, with the South Florida Tribune YouTube channel intact. So on behalf of Gary Kornbluh, my name is Scott Morgan, we're off the Motor City Madmouth. Thank you for joining us on this edition of the South Florida Tribune podcast. Once again, tonight our main objective, folks, was to give you a summary of the Medicare health insurance industry, and I hope that you've had an opportunity to gain that. And we look forward to doing more and more shows with Gary down the road as he continues to just dive in to this process and educate everybody out there. Because you know what? You can live with a lot of things, and you can live with them and live without them. And this is one thing you can't live without, this information, because knowledge is a power only if it's applied. And I'm very confident we accomplished that objective. So good night, everybody, and have yourself a great weekend. And tomorrow night, once again, Fire Up Michigan with myself, George Eichhorn, and Mark Mancini. So take care, everybody, and have yourself a great night. Bye-bye.
Good night, everybody, and thank you.